Let's discuss the Chinese and Western medical thought, the disease causation in Western medicine, part 2. Among modern philosophical approaches to causation, Mackey's Inus concept has been among the most helpful and was arguably the philosophical inspiration for the multi-causality model advocated by the epidemiologists like Rothman. Mackey extended Homi's idea that causes and effects are constantly conjoined and used the logic of necessary and sufficient conditions to describe cause and effect relations. An Inus condition is an insufficient but not redundant part of an unnecessary but sufficient condition. In Mackey's example of a fire following a short circuit in the house wiring, the short circuit alone would not have brought about a fire, but it was an essential, non-redundant part of a set of conditions: presence of inflamed material, absence of sprinkler, etc., that were sufficient to cause the fire. The Inus model would be helpful for explaining cancers that can be attributed to specific pathogens as the trigger factor. For example, the Helicobacter pylorus bacterium that is associated with stomach ulcers that could develop into cancers. This bacterium is not sufficient to cause stomach cancer, nor is it necessary, as many victims show no signs of the bacterium. But the clinical trials have shown that people who have it in their stomach have significantly higher chances of contracting cancer. For those who had the bacterium and contracted stomach cancer, the presence of the bacterium would be an Inus condition which, acting together with other unnecessary but sufficient factors, such as stress, irregular meals, and ingestion of foods with high level of carcinogens, could be a contributing cause to the patient's succumbing to cancer. In general, the presence of the bacterium would thus be viewed as raising the probability of contracting stomach cancer. This has indeed been borne out by observational clinical trials, and doctors now routinely administer antibiotics to remove it when it shows up in clinical examinations. Mackey's Inus concept had helped epidemiologists like Rothman and Greenland to propose multi-causality models such as the causal pie. So we have here the illustration, the one causal mechanism and the single component cause. Each constellation of component causes, representation in figure 1, is minimally sufficient to produce the disease. That is, there is no redundant component cause. Each one is a necessary part of that specific causal mechanism. A specific component cause may play a role in one or two or all three of the causal mechanism pictured. For example, excessive gastric secretion could be the common factor, A, in all three causal mechanisms, but the Helicobacter pylorus is present as G in the causal mechanism 2. A given disease can be caused by more than one causal mechanism, and every causal mechanism involves the joint action of a number of component causes. The purpose of this brief glimpse into the philosophy of causation has been to lead us to the idea that disease causation is not a simple case of discovering one or more contributing factors, that other consideration like motivation for identifying the cause may be involved. There may also be a role for values. Thank you for your attention.